So I'm Dr. Sloan. I'm the interventional spine specialist here at Steamboat Orthopaedic Spine Institute. And what I do is I take care of back and neck pain and radiating pain without having to do surgery. So the most common complaint that I see is back pain with pain that runs down the leg. And we call this lumbar radiculopathy, sometimes called sciatica. But usually it's caused by a disc herniation or a bulging disc that pushes on one of the nerves in your low back, or sometimes in the neck as well. And that can cause some back pain and pain traveling down the leg. So what we do is we do an X-ray guided procedure using this machinery that you see behind me. And this machine takes live X-rays. So basically, I can see things as it happens, and I guide the injection down using this machinery to the precise point where the disc is irritating the nerve. And we can confirm that the medication's going there by using a small amount of contrast, which is a fluid that will show up on my X-ray. And wherever that fluid goes is where my medication is going to go. So if I see that fluid running across the disc space and along the nerve, then I know that we have a good precise injection, and it makes sure that the medication goes exactly where we want it to and nowhere that we don't. So we use typically a needle like this, and we use the X-ray machine and guide it straight down into the back. Typically what we do is we have you lay down, we'll clean you off, we'll get you draped, and then I give you a numbing shot. And usually the numbing shot is the worst part of it, and it's not too bad. Just a little poke and a little burn from the numbing medicine, not even as bad as getting numbed up at the dentist. And then again, once we have the needle in place, we confirm that everything's doing well with some contrast, and then we do the injection of some medication, which is a numbing agent mixed with some steroid. Sometimes there's a mild discomfort as we put the steroid in, but it goes away very, very quickly, and usually the patient can go home, take it easy the day of the procedure. We like them to rest, and then the next day they can go about their normal activities. And typically over the next few days, that steroid and numbing medication is really going to kick in, and what it's going to do is, one, help the patient feel better a lot faster, but two, it's going to start decompressing that nerve and opening up the space around that nerve so the back feels better, the leg feels better. It gives a chance for that nerve to recuperate. And then once we get to the patient to that point, usually we'll do some very specialized exercises and some rehabilitation to strengthen some muscles that surround that area and run in between the bones of the spine to really support the spine better, take the pressure off that disc, and hopefully allow that disc to reabsorb while the steroid's in there helping control things. And so we use a multimodal approach of injections, rehab, sometimes medications, to really try to get that to reabsorb, go away, and hopefully stay away for a very long time. And that's how we are able to help the patients with lumbar radiculopathy avoid surgery. So if anybody is having back pain and pain running down the leg and they're interested in having this procedure or just talking about it a little bit more, you can go ahead and contact our office and give us a call and get set up with myself. Or you can go ahead and see your primary care physician as well, and they can direct you towards us.